Anneliese Dressel of the Health Hub Times Square in Ballincollig. Good afternoon to you, Anneliese. A lot of questions, so I want to get straight into them. Bernice in the city says, hi Patricia, would you please ask Anneliese, could you recommend something for a constant ear blockage? It's just on the right hand side. I've tried ear drops, but nothing seems to be working.
Okay, so it could be waxed. Hopefully it is just wax. So the ear candles are fantastic for that. They can be a little bit daunting for people who use them the first time. But basically it's like a kind of a waxed paper cone that you put into the ear and you light. And it creates a sort of a warm vacuum that melts the wax and pulls it up and out. It's brilliant as well for ear infections or anything like that. And there is a company called Otosan, and they do one that has a plastic insert that you can put in the ear, and they also provide you with a little protective circle at the bottom so that you don't drip wax on yourself. And they're really, really easy to use. So that's what I would recommend first and foremost for the blocked ear. There is also something called hydrogen peroxide, which is a kind of a bleach type thing you can buy in the pharmacy. It's pharmaceutical grade, and that can help dissolve very stubborn wax as well. But I would try the ear candle first, because that ear bleach does also affect the good bacteria in the ear, which you need as well, obviously.
Okay, hi Anneliese. I have a pain in my shoulder and down my left arm. I've had it for the last few weeks. Now I have had physio and acupuncture a few times, but it's not getting any better. The pain is actually now starting to wake me at night. The physio says it's my neck. The acupuncturist says it is my rotary cuff. My friends say it's menopause. Any advice would be gratefully appreciated.
Yeah, it could be any of those things, I
Yeah.
suppose, Patricia. The only thing I would say about the menopause pains in the joints is that they tend to be a little bit movable. So if it's the same pain in the same place all the time, I'd say it's unlikely to be menopause and more likely to be something to do with structure, a structural issue. Now, sometimes that rotary cuff does get inflamed. And the lovely thing about natural supplements is that they don't specifically work just for one area. So if you take a natural anti-inflammatory, it's anti-inflammatory for the brain, for the heart, for the muscles, for the joints, and for everything. So I would try something like that. So the best natural anti-inflammatories are boswellia, which come from frankincense, and curcumin, which is the extract of turmeric. So if you could get a combo of the two of those, I know that most health shops will have a Viridian one of combo, but the one we use here that we get great feedback on is called NutriAdvanced, and it's called CurCuDyn Forte, CurCuDyn, CurCuDyn Forte. And we get great feedback on that as a natural anti-inflammatory. The other thing you could try is a homeopathic remedy. Now, there's two that could be of value here. One of them is actually called Rhus Tox, and that's more for kind of muscular stiffness and rheumatism. It's good if you've got sprain of the joint or muscular sprains, and it's for if you feel better after moving it around for a short period of time. So that's spelled Rhus Tox, Tox. The other one then is Ruta Grav. This would be more relevant if it was the rotatory cuff, because it's great for injuries to tendons. And I found it great as well myself when I self-diagnosed, now to be fair, with plantar fasciitis. So that's very good for pulled tendons or anything to do with inflamed tendons. So you could try either of those homeopathic remedies.
Okay, good luck with that. And somebody who's suffering with sciatica nerve pain in my back, and it shoots down my leg. And also I'm feeling it on the outside of both of my hips. Any advice on what might help, says a Mill Street listener?
Yeah, the sciatica now, there's really nothing natural, to be honest, that I could recommend, because it's really where the nerve is so badly inflamed because of being mostly trapped. So the key really, I suppose, is to untrap that nerve, and that can always be very difficult because the disc is collapsing or there's a swelling of a disc. So, that's a long-term kind of a fix, really. So you could take the natural anti-inflammatories I mentioned above, but the best thing, and I've recommended this to friends, is to get an injection from the doctor into the periformis muscle in your buttock, and that actually paralyzes the nerve from sending those pain signals down the leg and the bum, through the bum. So it actually is great for pain management, and it might allow the sciatica then a little bit of time to kind of heal itself. So you could take the natural anti-inflammatories then. But ask your GP. It'll be a consultant or a specific doctor that will do it. You'll probably have to pay for it, but it's an injection into the periformis muscle.
And how long do you get it? Every 3 months then or something? Is it?
I don't know really.
Yeah.
I recommended it to pals of mine last summer, and it sorted them out. So whatever their sciatica was, what was causing the problem, obviously fixed itself. So they only got the one. But I'd imagine you probably need it every 6 months anyway.
Okay. Hi, Patricia. Question for Anneliese, please. It's regards castor oil. I've been seeing a lot about castor oil and its benefits on the internet for skin, for wrinkles, for hair, the body, for lumps and bumps. And I'm starting to wonder, is it any good or is it just a myth? And if so, is it easy to purchase?
So it has got huge popularity at the moment. There's been a lot of stuff on TikTok about it, Patricia, and of course a lot of the claims really they're spurious, they're not proven. So normally, we have to remember as well, the castor bean is actually quite toxic, so I would be very wary about taking it in high doses. Most people take it as a laxative. That's really why it's taken, so because it just runs through you. So in that case, it's not being absorbed. I would always recommend that if you're getting if you want to take it internally, that you would get an organic one, because you don't want to be taking an oil that's been sprayed and that's holding on to a lot of toxic pesticides. So other very good uses for castor oil that I could definitely stand by is that they does seem to encourage hair growth. So a lot of people use it for eyelashes and eyebrows. There was a lady in the other day who said she was recommended to put it on her eyes for dry eye. I don't think so. I think for dry eye, you need to put the fat in from the inside and take things like omega-7 from sea buckthorn and omega-3 from fish oils. I've also seen it for wrinkles. It's no better than any other oil for wrinkles. To be honest, you're as well off with olive oil. What else? Oh, yes, it's also excellent to use for a pain pack. So I'd often recommend it for people who have severe period pain. You put it onto a cloth and then you wrap it around a hot water bottle and then wrap it around a towel so that you don't get it onto your clothes. And you use that as a pain pack, and it can be wonderful for that.
Wow, that's an interesting one. Okay, that's where the internet can explode and some of it can just be myths.
Exactly. Chlorophyll was the fashion this time last year.
It was, yeah. It just gets shared and shared. Now, an email into Cork today at c103.ie from Anne. Anne says, hi, I'm a 56-year-old woman who's getting spots on my face every now and again. Small red spots, particularly on the T-zone, especially my nose. On my chin, I'm constantly getting reoccurring spots that form under the skin. Now, I eat a balanced diet as best I can. Why am I getting these spots? Any thoughts are how I can sort it out, please?
Okay, so it could be a couple of different things, Patricia. Age 58, maybe you're still kind of hormone imbalanced a little bit. Or it could be, sometimes these aren't actually acne spots. Maybe they could be allergy type spots. So it's difficult to know exactly what ones that they are. There is something called rosacea that sounds like this is it, because rosacea kind of does affect the nose. It can affect the cheeks as well sometimes in people, and maybe a little bit on the chin. So what I normally recommend for any skin problem to start with, just as a generic, is the Viridian Clear Skin Complex. It's a blend of different nutrients that support the skin, but also the liver. So if it is hormonal, or if it is, like, your skin will always act as a detoxifying agent if your liver and kidneys are not up to the task. So that's why if our diet goes to hell and we're, partying like mad, drinking our heads off, our skin will suffer, because it'll have to start detoxing. So this Clear Skin Complex has stuff in there to support the liver. It also has good bacteria for the face as well. So I could recommend that to start with. And then in terms of product use, we get great feedback on the Salcura Anti-Ac. It's very, very gentle. It's not expensive. Buy the face wash, and you also can get a spot treatment cream, and you can also get a kind of a spray moisturizer. So and there's very little to no chemicals whatsoever in this. So I would switch to that in case it could be the other, in case it's not acne. It could also be an allergy, and that will cover all the bases then.
Okay, hi Anneliese. I suffer with high blood pressure. I am on medication for it, but I'm starting to get flutters in my heart sometimes. Now, I have had an ECG done and everything is okay. What would you recommend for fluttering of the heart?
Difficult one, Patricia, really, because I don't know what's causing. Like with natural, you always try and treat the root problem as opposed to the symptom. The symptom is often a flag, so that's definitely something that you need to speak to your doctor about, because it could be a flag for a skipped heartbeat, in which again might need medication or even a pacemaker. It's difficult to know. So that should be your first port of call. Magnesium is one of the electrolytes along with calcium and sodium and potassium, and it's actually often one we're deficient in. So it might do no harm to take a magnesium supplement for a couple of weeks to see what that's sorted out. Sometimes as well in hot weather, Patricia, we become dehydrated because we drink too much water, because what you're doing is you're diluting these electrolytes in the body. So actually buying electrolytes during hot weather when you're sweating a lot and adding it into the water, or alternatively adding a pinch of sea salt or Himalaya salt into your water, will provide a good balance of the potassium, sodium, chloride, magnesium that our body needs to function properly. So you could try doing that, following that as well. And if that doesn't sort it out, I definitely would talk to your doctor.
Yeah, absolutely. And then Marge says, hi Anneliese, I've just been diagnosed pre-diabetic, not overweight, and I consider my diet to be reasonably okay. Any advice, please?
Yeah, well, that's actually a great way to be is pre-diabetic, because you can actually reverse it and you can prevent it from developing into full-blown type 2 diabetes. So for most people, type 2 diabetes is because of insulin resistance, which means that your cells, for some reason, have stopped listening to insulin as a signal. So it's not getting the glucose out of your blood into your cells effectively. What happens then is that your blood, like glucose in the blood, it's like too much sugar in your tea. It thickens the blood, so it can be quite dangerous. So your body takes that out of the blood and stores it as fat. But then you'll feel thirsty because of the thickened blood and the need to dilute it down. You'll feel low energy because you're not getting your sugars into your blood. And over the long term, elevated blood sugar causes problems to proteins, and it damages your eyes and your small vascular tissue. So to improve insulin sensitivity, I would recommend following a low carbohydrate diet. You'll find 101 of them on the internet. So what it really means is that you're eating plenty good quality protein like fish, meat, eggs, nuts and seeds, and loads of vegetables, and you're cutting out all sugar and sugary foods, and you're having only tiny portions of bread, pasta and potatoes. And then supplements that can help. First one I would recommend is the omega-3 fats, because they will improve the cell's sensitivity to insulin. There's also something called berberine, which is a miracle, really. It's actually, in studies, is shown to be almost effective as this new drug, the Ozempic. But you must be careful with your medication, so check your medication with the health shop. And berberine is a fantastic one for improving sensitivity to insulin. You have other things as well, like chromium, bitter melon is very good, and alpha-lipoic acid. So a blend of all of these will help improve your body's ability, and then the diet will bring it backwards, and you can absolutely 100%, I would say, reverse it.
Okay, listen, we'll leave it there. Thank you for that. Have a lovely week, and we'll chat next Monday.
Thanks, Patricia.
Thanks a million. That's Anneliese July of the Health Hub Times Square in Ballincollig.